5 surprising signs of diabetes you shouldn't ignore. Number 5, slow healing wounds. If you notice cuts or bruises taking longer than usual to heal, it could be a red flag for diabetes. High blood sugar levels can damage blood vessels and nerves, slowing down the healing process. Number 4, frequent urination. Constantly running to the bathroom, your body might be trying to flush out excess glucose through urine, a common symptom of diabetes. Number 3, unexplained weight loss. Losing weight without trying might seem like a dream, but it could be your body burning muscle and fat for energy because it can't use glucose properly. Number 2, blurry vision. High blood sugar can cause the lens in your eye to swell, leading to temporary vision changes. If left unchecked, it could lead to more serious eye problems. Number 1, tingling or numbness in hands and feet. This sensation, known as neuropathy, occurs when high blood sugar damages nerve fibers, particularly in your extremities. 5 surprising signs that frequent urination could be diabetes. Number 5, increased thirst. If you're constantly reaching for water and still feeling parched, it might be more than just dehydration. Number 4, unexplained weight loss. Shedding pounds without trying. Your body might be burning fat for energy instead of glucose. Number 3, blurry vision. High blood sugar can cause the lens in your eye to swell, leading to fuzzy sight. Number 2, slow healing wounds. Elevated glucose levels can impair your body's natural healing processes, making cuts and bruises linger. Number 1, frequent urination, especially at night. If you're making multiple trips to the bathroom after dark, it could be your body's way of flushing out excess sugar. Remember, these symptoms don't always mean diabetes, but if you're experiencing them, it's worth checking with your doctor. Early detection can make all the difference in managing this condition effectively. 5 surprising signs of diabetes you shouldn't ignore. Number 5, excessive thirst. If you find yourself constantly reaching for water, it could be a red flag. Diabetes causes your body to flush out excess glucose through urine, leading to dehydration and intense thirst. Number 4, frequent urination. As your body tries to get rid of extra sugar, you'll need to pee more often. This can disrupt your sleep and daily routine. Number 3, unexplained weight loss. Despite eating normally, you might notice the pounds dropping off. This happens because your body starts burning fat and muscle for energy when it can't use glucose properly. Number 2, blurred vision. High blood sugar can cause the lens in your eye to swell, leading to fuzzy vision. This change can be temporary or permanent if left untreated. Number 1, slow healing wounds. Diabetes can damage blood vessels and nerves, making it harder for your body to heal cuts and bruises. Even small injuries may take weeks to heal completely. 5 surprising facts about fatigue and diabetes. Number 5, fatigue can be an early warning sign of diabetes. Many people experience extreme tiredness before other symptoms appear, making it a crucial indicator to watch for. Number 4, blood sugar fluctuations cause energy crashes. When glucose levels spike and drop, it can lead to sudden bouts of exhaustion, even after a full night's sleep. Number 3, dehydration amplifies fatigue in diabetics. High blood sugar levels cause increased urination, leading to fluid loss and intensifying feelings of tiredness. Number 2, sleep apnea is common in diabetics. This sleep disorder can cause chronic fatigue, creating a vicious cycle that worsens blood sugar control. Number 1, exercise paradoxically fights diabetes-related fatigue. Regular physical activity can boost energy levels and improve insulin sensitivity, helping to manage both diabetes and fatigue. Understanding these connections between fatigue and diabetes can lead to earlier diagnosis and better management of the condition. 5 reasons why regular blood sugar checks are crucial in South Africa. Number 5, early detection saves lives. Regular checks can catch diabetes before it becomes severe, allowing for timely intervention and better health outcomes. Number 4, lifestyle adjustments become easier. Knowing your blood sugar levels helps you make informed decisions about diet and exercise, leading to improved overall health. Number 3, pregnancy complications can be avoided for expectant mothers. Monitoring blood sugar is vital to prevent gestational diabetes and ensure a healthy baby. Number 2, it's cost-effective in the long run. Regular checks may seem expensive, but they're far cheaper than treating advanced diabetes complications. Number 1, South Africa has a high diabetes prevalence, with over 4 million diabetics in the country. Regular checks are essential for managing this growing health crisis and reducing its impact on individuals and the healthcare system. 5 diabetes facts that will blow your mind. Number 5, numbness in feet can be an early warning sign. Diabetes can damage nerves, causing a loss of sensation that starts in the toes and spreads upward. This condition, called neuropathy, affects up to 50% of diabetics. Number 4, tingling sensations are not just annoying, they're alarming. These pins and needles feelings in your feet could indicate that your blood sugar levels are consistently too high, damaging your peripheral nerves. Number 3, foot ulcers are a serious complication due to reduced sensation. Diabetics may not notice cuts or blisters on their feet, which can lead to dangerous infections if left untreated. Number 2, diabetes can cause poor circulation. This reduced blood flow to the feet can slow healing and increase the risk of infections. Number 1, regular foot checks are crucial. Daily self-examinations of your feet can help detect problems early, potentially preventing severe complications like amputation. 5 surprising ways blurred vision can signal blood sugar problems. Number 5, sudden blurriness. If your vision suddenly becomes fuzzy, it could be a sign of rapidly changing blood sugar levels. This occurs when the lens of your eye swells due to excess glucose in your blood. Number 4, fluctuating vision clarity. Your eyesight might seem clear one moment and blurry the next. This roller coaster effect often indicates unstable blood sugar levels throughout the day. Number 3, night vision difficulties, struggling to see clearly in low light conditions. High blood sugar can damage the blood vessels in your retina, affecting your ability to see in dim environments. Number 2, double vision. Seeing 2 images instead of one isn't just disorienting, it could be a sign of nerve damage caused by prolonged high blood sugar levels. Number 1, temporary blindness. In extreme cases, severely high or low blood sugar can cause temporary vision loss. This alarming symptom requires immediate medical attention to prevent permanent damage. 5 shocking facts about family history and diabetes risk. Number 5, genetic predisposition. If your parents or siblings have diabetes, your risk of developing the disease increases significantly. This genetic link can be as high as 40% for type 2 diabetes. Number 4, shared lifestyle habits. Families often share similar diets and exercise patterns, which can contribute to increased diabetes risk across generations. Number 3, epigenetic changes. Environmental factors can alter gene expression, potentially passing down diabetes risk even without direct genetic inheritance. Number 2, gestational diabetes impact. Women who experience gestational diabetes during pregnancy have a higher chance of developing type 2 diabetes later in life, and their children may also be at increased risk. Number 1, ethnic background influence. Certain ethnic groups, such as African Americans, Hispanic Americans, and Native Americans, have a higher genetic predisposition to diabetes, highlighting the importance of family history in these populations. 5 skin changes that may signal undiagnosed diabetes. Number 5, dark patches on the skin. Known as acanthosis nigricans, these velvety, dark areas often appear on the neck, armpits, or groin, signaling insulin resistance. Number 4, slow healing wounds. High blood sugar can impair circulation and damage nerves, making it harder for cuts and bruises to heal. Number 3, frequent skin infections. Elevated glucose levels create an ideal environment for bacteria and fungi to thrive, leading to more frequent infections. Number 2, dry, itchy skin. Diabetes can affect the body's ability to sweat, resulting in dry, itchy skin that's prone to cracking and peeling. Number 1, yellow, reddish, or brown patches. Called necrobiosis lipoidica, these patches often appear on the shins and can be a sign of long-term diabetes complications. If you notice any of these skin changes, consult a healthcare professional for proper evaluation and diagnosis. Did you know that where you live can affect your risk of getting diabetes? I'm a doctor in South Africa. And we have a high risk of diabetes here. Our lifestyle is just too good. We love our carbs and our sugars. I mean, look at this. This is what people eat when they go to a restaurant. This is not even the full meal. This is just the side dish. And then there's the portion sizes. Here in South Africa, we don't do things by halves. We like to eat until we're almost sick. And then we order dessert, which is usually ice cream or fat cakes. I mean, who doesn't love their carbs and their sugar? But the problem is that we don't get enough exercise. The only time we move is when we go to the car and we sit back down. That's when we start eating again. So if you're living in South Africa and you're worried about your risk of diabetes, well, the best thing to do is to move more and eat less carbs and sugar. But honestly, who wants to do that? Not me. I'm just gonna move to a country with better weather. Are you at risk for type 2 diabetes? Well, you're not alone. Millions of people are at risk. And it's becoming one of the leading causes of death worldwide. But the good news is that there's a lot that you can do to prevent it. And it starts with what you eat. You see, when it comes to type 2 diabetes, it's all about the diet. You can actually prevent and even reverse type 2 diabetes by eating the right foods. So, what are we waiting for? Let's get started. First, you need to understand that the main cause of type 2 diabetes is insulin resistance. When your body becomes resistant to insulin, it can effectively use glucose for energy, so it starts to build up in your bloodstream. This is where the problem starts. But the good news is that there are certain foods that can help you overcome insulin resistance and lower your risk of developing type 2 diabetes. These include lean proteins, fruits, vegetables, whole grains, and healthy fats. So if you want to prevent type 2 diabetes, start by eating these foods. Your body will thank you for it. Are you too afraid to weigh yourself? Well, you should be. Being overweight or obese makes you 8 times more likely to develop type 2 diabetes. And it's all because of this. When you gain weight, your body becomes resistant to insulin, which is a hormone that helps regulate your blood sugar levels. And when your body is resistant to insulin, your blood sugar levels rise, which over time can lead to type 2 diabetes. But it doesn't have to be this way. You can reduce your risk of developing diabetes by making some simple lifestyle changes, such as eating a balanced diet, exercising regularly, and getting enough sleep. So, what are you waiting for? Make your health a priority today so that you can live a long and healthy life tomorrow. That was a summary of. For more health tips, please subscribe to our channel. Did you know that there are early screening tests available in South Africa for the following? HIV. There is a simple blood test that can detect the virus in your body within 3 to 6 months of infection. This test is currently being offered free of charge by the Department of Health.B.Cancer. There is a screening test for cervical cancer that can be done at home. The test costs 250 Rand and takes about 2 minutes to perform. See mental health. There is a screening tool that can be used to identify common mental disorders such as depression and anxiety. The tool consists of a series of questions that you need to answer, and it's completely free. D. Alcohol and drug abuse. There is a screening test that can detect the presence of drugs and alcohol in your system. The test costs for 150 are A and D, E. Fertility. If you're struggling to conceive, there is a test that can tell you if you are ovulating regularly. The test costs 750 Rand. These screenings can help detect problems early when they are most treatable. So it is important to make use of them. For more information, visit the website below. You know, we have the ability to prevent most of the cases of diabetes out there, but we're not doing it. I'm gonna tell you why. One of the biggest risk factors for developing type 2 diabetes is being overweight. And the only way to really prevent that is through regular physical activity. Now, I'm not talking about going to the gym and lifting weights. I'm talking about getting your body moving on a regular basis. The good news is that you can prevent diabetes by getting active if you're overweight. If you have the ability to lose a little bit of weight, get your body mass index down to a healthy level, you can actually reverse insulin resistance and prevent the onset of type 2 diabetes. And if you already have type 2 diabetes, getting physically active and increasing your muscle mass is one of the best ways to control your blood sugar levels and to reduce your risk of complications FR. Diabetes. So let's get moving. How does stress affect your blood sugar levels? You may think of stress as a purely psychological phenomenon, but it's actually very physical as well. When you're stressed, your body releases a flood of hormones, including adrenaline and cortisol. These hormones can raise your blood sugar levels, and chronically elevated blood sugar levels can lead to problems like insulin resistance and type 2 diabetes. But it's not just about the stress hormone. When you're stressed, you're more likely to eat high-carb foods and drinks, which obviously will raise your blood sugar. You might also skip meals when you're stressed, which can lead to low blood sugar. And then there's the added stress of trying to manage your blood sugar levels. This can be especially challenging if you're also dealing with a chronic illness or condition like diabetes. The good news is that there are things you can do to mitigate the effects of stress on your blood sugar levels, like getting enough sleep, exercising regularly, and eating a healthy diet. You won't believe what happens when you have diabetes and high blood pressure. When it comes to diabetes and high blood pressure, knowledge is power. Here's what you need to know. First, high blood pressure is one of the most common conditions that people with diabetes have. It can cause serious complications like heart disease and stroke. So it's important to get your blood pressure under control. But here's where things get interesting. Having diabetes doesn't make you more likely to get high blood pressure. However, having high blood pressure makes you more likely to develop diabetes. That's because high blood pressure damages the body's small blood vessels, which then releases a hormone called insulin. And too much insulin in the bloodstream can lead to insulin resistance, which causes type 2 diabetes. So if you have diabetes, it's crucial to keep your blood pressure in check, but don't worry. There are plenty of things you can do to lower your risk of complications from both diabetes and high blood pressure. Stay tuned for more tips. This is how smoking raises your risk of getting diabetes. You see, when you smoke, your body releases a hormone called cortisol. Cortisol is also released when your body is under stress. And too much cortisol for too long can lead to diabetes. But that's not all. Smoking also damages the cells in your pancreas that produce insulin. And guess what? Those cells need insulin to work. So when they're damaged, they can't produce enough insulin to keep your blood sugar levels in check. And let's not forget about the fact that smokers are more likely to have a fatty liver, which is also linked to diabetes. So if you're smoking right now, please stop. And if you're not, well, keep it that way. Your future self will thank you. Why do 90% of people die from a disease they don't even know they have? That's because they don't go to the doctor regularly. When you don't feel sick, you don't think you need a checkup. But checkups are important to catch diseases early. Many diseases have no symptoms in the early stages. You can be walking around right now and not even know you're sick. For example, one study found that 40% of people with diabetes don't know they have it. That's why it's so important to get your blood sugar checked regularly, especially if you're over the age of 45. If you're younger than that, it's still important to get your blood sugar checked every 5 years. Other diseases like cancer can be detected early through screenings. There are tests that can detect cancer cells in your body before you even feel any symptoms. So if you haven't been to the doctor in a while, it's time to make an appointment. Early detection is key to staying healthy. I'm gonna give you 5 tips to reduce your risk of diabetes. And you can do these 5 things today. No. 1. Get more sleep. The American Diabetes Association recommends 7 to 8 hours of sleep per night. Not kidding. Enough sleep can increase your risk of diabetes. Number 2. Eat more fiber. Fiber helps regulate blood sugar levels. Good sources of fiber include fruits, vegetables, whole grains, and legumes. 3. Exercise regularly. The American Heart Association recommends 150 minutes of moderate intensity exercise per week. This can help improve insulin sensitivity. 4. Drink plenty of water. Staying hydrated can help your body process carbohydrates more efficiently, which can lower your risk of diabetes. And number 5, don't smoke. Smoking increases your risk of diabetes and heart disease. Quitting smoking can help reduce your risk of developing diabetes. And if you're worried about your risk of diabetes, talk to your healthcare provider. They can help you assess your risk and make recommendations based on your individual needs. Remember, small changes can make a big difference. So take action today to reduce your risk of diabetes. Why do some people have great health outcomes with diabetes and others don't? I'll give you 3 reasons why. Number 1 is access to health care. If you can't get to a doctor on time or at all, your health outcomes are gonna be worse. I know this because I've seen it in my clinic. We have patients who drive over an hour to get to our clinic because they can't get in to see their primary care doctor. And when they do get in to see their primary care doctor, sometimes they have to wait so long that they fall asleep in the waiting room. No. 2 is access to healthy food. If you don't have access to healthy food, your blood sugar is going to be higher. I know this because I've lived it. I've been in food deserts. You go to the corner store because it has closed and you don't have a car and you need to get food now. So you grab whatever you can, but it's expensive and it's not healthy. And no. 3 is access to safe places to exercise. If you don't have a safe place to exercise, your blood sugar is also going to be higher. I know this because I've talked to patients who have told me that they don't feel safe outside or they don't have transportation to get to a park or a gym. Here are the most common ways that diabetes presents itself in South African patients. So we know that diabetes is a big problem in South Africa, but how do people actually present? Well, the most common type of diabetes that we see in our practice is type 2 diabetes, and it usually presents with a slow onset of symptoms. So people will often feel tired, fatigued, and they'll be thirsty all the time. They might also have blurred vision because the eyes are very sensitive to changes in blood sugar. Now, if you're a diabetic, you might also have other medical conditions like high blood pressure or high cholesterol. And This is because diabetes is a risk factor for developing these conditions. So it's really important to get your blood sugar under control to prevent these other diseases. The good news is that there are lots of things that you can do to improve your health and well-being. So if you're feeling unwell, go see your doctor. Why do people in rural areas have a higher risk of dying from diabetes? Well, it's not what you think. There's a big difference between rural and urban diabetes symptoms. You see, when someone in an urban area has a heart attack, they're more likely to get to a hospital in time. But in rural areas, people often don't make it to the hospital in time because they live far away and there is no one around to help them. But that's not the real reason why people in rural areas die more from diabetes. The real reason is actually quite shocking. It's because when you're in a rural area, you're more likely to be exposed to pesticides and insecticides, which are extremely dangerous for your health. And the sad thing is, most people don't even know they're being exposed to these chemicals. The good news is, if you know about it, you can avoid it. And that's why it's so important to keep learning. Because knowledge is power, and with knowledge, you can truly become free. What do you think is the most dangerous food in the world? For some of us, it's not what you think. It's not junk food or sugar, even though that can be deadly. It's actually certain vegetables. And for others, it's red meat. I'm gonna explain why. See. Our bodies don't know the difference between a cow that's been fed grass or grain. To our bodies, they both look like beef. So when we eat them, they both raise our insulin levels, but one will raise it much more than the other. Can you guess which one? The problem with modern diets is that we're constantly eating foods that raise our insulin levels. Too high and too fast, like white, red, and pasta. This spike in insulin causes blood sugar crashes, hunger, and cravings, and over time, it makes us feel tired and off our game, but there's hope. By following a low-carb diet, we can reduce our insulin levels and get off the roller coaster ride of blood sugar highs and lows. This is the best way to prevent diabetes and its complications. This is why we get more sick as we get older. As a kid, when you get a fever, your mom or dad would give you some medicine to help you feel better. And as you grew up, you started to notice that you got sick more often as an adult. Why is that? Well, the medicine that you used to take as a child would actually mask the symptoms of certain diseases, allowing them to go undetected and untreated. This led to you becoming a walking reservoir for various pathogens, which then caused you to get sick more often as an adult. For example, when you have a fever, your body is trying to tell you that you have an infection. The elevated temperature helps the immune system fight off the pathogen by making it harder for the virus or bacteria to replicate. So if you take something like Tylenol to lower your temperature, you're also lowering the defenses in your body, allowing the infection to spread and become more severe. This can lead to complications down the road, especially as you get older and your immune system gets weaker. So what can you do to avoid this? Well, first, you need to stop taking medicine to mask your symptoms. This may be hard at first, but it will pay off in the long run. Second, you need to start taking care of your body by eating healthy foods, exercising, and getting enough sleep. This will strengthen your immune system and make it easier to fight off infections. This is the most important message I've ever shared in my life. Please listen carefully. There's a global health crisis happening right now. People are dying from diabetes every single day, and we don't even know it. That's because the symptoms of diabetes are so sneaky. They can go undetected for years. I'm a doctor, and I'm on a mission to change that. I want to empower you with the knowledge to protect yourself and your loved ones from this disease. When we talk about diabetes, most people think about type 1 and type 2. But there's actually 3 types. And type 3 is the most dangerous. It's called gestational diabetes. It happens when a pregnant woman has high blood sugar. You might be thinking, how does this affect me? Well, it affects you in more ways than you can imagine. You see, when a baby is born to a mother with gestational diabetes, they have a higher risk of developing type 2 diabetes later in life. The good news is that with early detection and treatment, we can prevent that. So please share this video with your friends and family. Let's save lives together. This is the one medical condition that I think we should all be aware of. And it's not actually a medical condition. It's a lack of access to health care. When you don't have enough money, you can't go to the doctor on time. When you can't go to the doctor on time, you get misdiagnosed or you don't get diagnosed at all. And that leads to a lot of unnecessary suffering. There are so many people who are suffering from mental health conditions, from physical health conditions, who don't need to be suffering if they had access to health care. If you are someone who has access to health care, I am envious of you. Please do not waste it when you go to the doctor. You have insurance. You don't have to pay out of pocket. You don't have to wait in line for months to see a specialist. That is a luxury that not everyone has. If you are one of the lucky ones, please use your privilege to help others. Be an advocate for those who don't have a voice. Be an ally to those who are struggling. Here are some scary symptoms that you should never ignore in your children or adolescents. As a family physician with children and adolescents for over 20 years, I've seen it all. And there are certain things that if you see in your child, you need to get help immediately. No, one is a change in behavior. If your child is normally happy and outgoing and then suddenly becomes sad and withdrawn, that is a red flag. No, 2 is a change in sleep. If they're sleeping too much or not sleeping at all, that is a red flag. No. 3 is a change in appetite. If they're eating too little or too much, that is a red flag. No, 4 is a sudden weight loss or gain. That could be a sign of an eating disorder or something else serious. No. 5 is a rash that doesn't go away. It could be a sign of abuse. And no. 6 is any type of pain that they're experiencing that you can't explain. If you see any of these signs in your child, don't hesitate to seek professional help. Early intervention is key. Here's how seasonal changes can affect your diabetes symptoms. As the weather gets colder, your body produces more of a hormone called insulin. This can help lower your blood sugar levels, which is great for people with type 2 diabetes. But as the days get longer and the sun shines brighter, your body produces less insulin. This can lead to higher blood sugar levels, which is not so great for someone with diabetes, but it doesn't stop there. Seasonal changes can also affect your appetite and your activity level. For example, during the winter months, many people gain weight because they're spending more time indoors and exercising less. This can make diabetes symptoms worse. Fortunately, there are things you can do to help manage your diabetes symptoms year-round. Eating a healthy diet, getting regular exercise, and taking your medication as prescribed can help you keep your blood sugar levels in check. No matter what the weather is like outside, it's also important to be aware of the signs and symptoms of high and low blood sugar, and to know how to treat them. If you have diabetes, it is important to work with your healthcare team to develop a plan that meets your individual needs and helps you live a healthy life. Even when the seasons change, here are some early signs of diabetes that only women have. As a man, one of the first signs that I noticed was that my wife was constantly getting sick. She would get these horrible cold sores, and we would have to go to the emergency room because they would be life-threatening. I was like, how is this possible? We're both eating the same food. We're doing everything together. Why is she getting sick all the time? I'm not gonna lie. It was super frustrating. Then I started to notice that she would have these random moments where she would just be in a diabetic coma for no reason. I knew something was wrong. I could tell by the way that her skin was looking. It was just this sort of leathery, dry texture. And I could tell that she had diabetes before she even told me because I've seen enough videos about it. 5 common early symptoms of diabetes you should never ignore. Number 5, increased thirst and frequent urination. If you find yourself constantly reaching for water and making more trips to the bathroom, it could be a sign of high blood sugar levels. Number 4, unexplained weight loss, despite eating normally or even more than usual. You might notice a sudden drop in weight. This occurs as your body starts burning fat and muscle for energy. Number 3, blurred vision. High blood sugar can cause the lens in your eye to swell, leading to temporary vision changes. If left untreated, it can lead to more serious eye problems. Number 2, slow healing wounds. Diabetes can affect your body's ability to heal, making cuts, and bruises take longer to recover. This is especially noticeable on your feet and legs. Number 1, fatigue and weakness. Feeling constantly tired even after a good night's sleep could be your body's way of telling you something's wrong with your blood sugar levels.